This is DermDad here. Just want to take a few minutes and go over some of the skin findings for the new coronavirus. And as you can see, it kind of has been in the news lately that there are skin findings in coronavirus. Some of this has come out of Italy, where they've shown approximately 20% of patients had skin findings. Um, a lot of this was at onset, or some of it was after hospitalization. So that's kind of important to notice as well. So one of the questions would be, when does this rash come up? A lot really isn't known at this time. There have been many different kinds of manifestations of the rash itself. I'm going to briefly touch on a few of these. One of the findings they've found are eczematous type rashes. They also have had rashes that are more, let's see, more vesicular, hive-like, blotchy, just different kinds. So it's kind of featured here, and this is an article off of MSN.com. So I think the key finding here, these are examples of eczematous rashes. A lot of times they're dry, scaly areas. Eczema is very common. You can see it in regular folks, especially in the wintertime, springtime with the pollen, that kind of thing. Um, One of the issues with eczematous rashes, though, is that they're very common anyways. So it's hard to say if you take 20% of the normal population, it's possible you may see these kind of rashes anyways, and that's something that needs to be elucidated further. But then looking at hives are often more allergic looking rashes with urticaria, raised bumps, as you can kind of see in some of these pictures. Here's a few classic hives. So hives would make more sense with coronavirus. It seems to set off a cascade of inflammation, which is commonly seen with hives. But then really the other finding that is of particular interest is the livedoid pattern. And livedo basically is something you see with autoimmune type diseases. See it with coagulopathies where the blood vessel and coagulation cascade is affected, and this can kind of affect the blood flow to the subcutaneous tissue, the layer right underneath the epidermis and dermis, and you get this mottled appearance like you see in this picture. This is a pretty classic livedo pattern. So you can see this with autoimmune diseases, but it would make sense that it would also be seen in this particular kind of scenario with coronavirus, as it is considered to be a coagulopathy. A separate rash that looks similar to this, often seen with autoimmune diseases as well, also with frostbite, is a thing called pernio, and this is when you kind of have this blue toe type of appearance, as you see here, kind of see it here. And this would also make sense if you have a process that's clotting off the blood vessels. You would expect to see some of these findings as well. So, bottom line is, there may be a rash component to the coronavirus. It really isn't known fully at this time as to how prevalent it is. The earlier reports out of Italy are suggesting 20% prevalence. So the thought is that if someone has symptoms that are classic to coronavirus, some of these symptoms right here, the fever, the cough, aches, pains, general malaise, just not feeling well, that kind of thing, and has a classic rash as described, then it would be worth going in and just having that checked out and probably being tested, quite frankly. So look, I hope this is helpful. Thanks for watching. You guys have a great day.